Hello, welcome to our session once again. If you're a returning subscriber and if you're new here, welcome. Here is our session and a series that we are conducting on ending FGM. So in this class, we are going to look at ethics and code of conduct that governs the different healthcare workers when it comes to care, management, and prevention of FGM, with specific focus in Kenya. So my name is Barawa, and this is a supported series on sensitization on ending FGM, and this is done in partnership with the University of Nairobi, the Girl Generation, and ACAF, which stands for Africa Coordinating Center for Abandonment of FGM. So please be with me all the way to the end as we debunk on professional ethics and code of conduct for doctors in Kenya as to the care, management, and prevention of FGM. So let's start with the basics. What is professional ethics, or what do we mean by code of conduct? So professional ethics and code of conduct, this refers to the professional standards, that doctors, nurses, midwives, or healthcare workers should uphold when it comes to conducting themselves professionally or when they are offering their professional duties. So professional ethics and code of conduct, they represent at a professional level the moral, the ethical, and the legal obligations. More so in this case, we're talking about the healthcare professionals. Here we can have doctors, we can have nurses, we can have midwives, we can have all categories of healthcare workers that fall in this category here. So this is how we should uphold ourselves while practicing in the different areas of our specialties. But then when we bring this down to the side of female genital mutilation, there are certain code of ethics that guide us as to why we should stop the practice of female genital mutilation as healthcare providers. Let's begin with the caliber of doctors. So in Kenya, there are certain ethics that should guide the practice of a doctor or should actually guide the day-to-day practice of the doctor in how they conduct themselves. So one of it is the Hippocratic Oath. So this is the oath that doctors take to show that they are going to commit themselves into offering services to clients without harm and protecting their rights or protecting their well-being. So the oath reads, "The health of my patients will be my first consideration. I will maintain utmost respect for human life from the time of conception and even under threat. I will not use my medical knowledge contrary to the laws of humanity." So what does this oath bring on board? The essence of this is that healthcare providers should undertake is they should not or they should do no harm. That is, they should protect the patient. They should protect the human life from the time of conception all the way to any moment when it's under threat. And I want to reinstate on this when we were talking about when someone gets to be undergo the FGM. So best of the communities are those who do it at a very tender age, like on day one of birth, and then there are those who do it at adolescent levels, and then there are those who do it while the women are adults or they're trying to get married. So at any possible level, it is not permitted that healthcare providers participate in the practice of FGM. So do no harm. Then the second bit that this brings out is that we have a responsibility to safeguard and preserve life at all times in the conduct of their professional duties. So it comes in that we need to uphold life, we need to safeguard life regardless of the situation. And if it's under threat, then we should come on board and protect the human dignity and the human life. And when we have been learning about FGM is that it's a criminal offense, it's a form of gender-based violence, and it's a violation of human rights. So keeping on, the next code of conduct that guides our doctors in Kenya is the Medical Practitioner and Dentist Board. So this is an act of parliament. It's contained in our constitution. So what this act does is establishes a board, what we call the Medical Practitioners and Dentist Board. So what this board does, it publishes the code of professional conduct and discipline that is applicable to the doctors and dentists, and it has several chapters, or it has sections that outlines how doctors should conduct themselves, how nurses should conduct themselves, basically not sorry nurses, but how dentists should conduct themselves. So it caters for For the dentist, it caters for the doctors. It's also catered for the pharmacist. So in the chapter 4 of this code of conduct, it describes the type of conduct that can raise disciplinary issues. And remember, FGM is among the practice that is punishable by law. So in chapter 4, around clause 17, it provides for that conduct negatively affecting the reputation of the profession, or at subclause C, instead that the board may take any action against a practitioner who is convicted in a court of law for any offense. So remember, in this case, female genital mutilation is a criminal offense. So if someone has been caught in the practice of FGM, it means that the board, in this case, this is the professional body that can hold the doctor accountable in a court of law and can be judged based on the act and also for the punishment that they can be given. So the board might take disciplinary action against him or her as the doctor is provided under the Medical Practitioners and Dentist Board. So this act establishes the code of conduct in the form of discipline, and it can raise disciplinary measures in case a doctor is caught in the act of practicing FGM or practicing different acts that are against the law. So continuing with the same when it comes to the Medical Act, it also says under Chapter 5 of the Code that it recognizes international norms as forming part of the professional ethics and ethical conduct framework in Kenya. So the code recognizes that the Internal Code of Medical Ethics of 1949, which provides that a doctor must maintain the highest standard of professional conduct and must practice his profession uninfluenced by any motive of profit. Now, under the part of the drivers that lead to practice of medicalization, you saw that source of income, like an extra source of income, is one of the reasons that part of healthcare providers practice medicalization of FGM. Now, when it comes to medical practice, the urge to make extra income comes in as part of the reasons why you can be held accountable for that. Profiteering is one of the reasons underlining the medicalization of FGM. Therefore, where a doctor performs FGM in order to attain financial benefits, this will constitute an ethical conduct. Therefore, they can be held liable in a court of law and they can be charged. And then we have the third ethical and code of conduct that can apply when it comes to cases around management of FGM among doctors. There is the third one, what we call the Declaration of Helsinki on Human Experimentation. So this is part of the framework on professional ethics for medical practitioners in Kenya. It requires every medical practitioner to respect human life and do all that is reasonable possible to just preserve and improve the quality of human life. Do not do anything which may cause suffering or terminate life except as provided in the law. Give advice and treatment as shall be necessary to reduce the suffering of his or her patient. Doctors should respect human rights of their patients and preserve the patient's fundamental human rights. Thus, it is unethical for medical practitioners to carry out FGM because it is a practice that goes contrary to the human rights of women and girls. So a medical professional who is convicted of criminal offense or is accused of infamous or disgraceful conduct may have action taken by the board against him or her, and this can include suspension for a period not more than 2 years. So we can see that these different code of ethics come in place to just hold the doctors accountable based on the different action they have taken, just promote either the practice of FGM in general or promote the medicalization of FGM in our communities. So Kenya have highlighted the different code of conduct that come into play when it comes to holding doctors accountable. And you can see the Declaration of Helsinki, we have the Hippocratic Oath, and we have the Medical and Dentist Act that comes in play to just clearly establish the code of conduct, clearly establish the disciplinary measures that can be taken in case a medical doctor is caught in the practice of medicalization of FGM or generally practicing FGM in the community. So this brings us to the end of this session on professional ethics and code of conduct among doctors when it comes to care and management of FGM in our society. Please, you can like our videos, give us a thumbs up, comment, share, and don't forget to subscribe. So till we meet again, bye bye.